Hello everyone, this is Sahaana Mohanraja, a third year pediatric dental resident from Hamdan bin Mohammed College of Dental Medicine. So today in this poster, we'll be discussing a cross-sectional study which is titled Whole versus Conventional Preformed Metal Crowns, Radiographic Identification by Pediatric Dentists. Before discussing the study, I would like to give you a little background. In pediatric dentistry, the use of preformed metal crown has been done in the management of multiple surface caries lesion. Over the years, this is usually done with a conventional method where a tooth is anesthetized, a tooth preparation being made, which allows the fit-in of the preformed metal crown. In the recent years, with the help or the introduction of the hole technique, this has been made easy. Hole technique, which is popularly known as no needle or no drill technique, which consists of just placement of the elastic separators, opening up the space, which in turn allows the cementation of the hole technique. While hole technique has been widely accepted, there have been few questions being raised. One of them being questioning the size, the fit of the whole crown. It is assumed usually that the crowns being placed using the hole technique are mostly oversized or they have a poorly fitting crown with some overhanging margins. While the fit of the crown has been assessed clinically, our study is aimed to evaluate if pediatric dentists can identify the radiographic differences of the preformed metal crown on the primary molar tooth, with those seated with the whole technique to those seated using the conventional technique. So this study was done with the help of an online questionnaire, which consisted of 25 questions, including 10 randomly chosen bitewing radiographs, which showed preformed metal crowns. This questionnaire was emailed to pediatric dentists across the globe via the Global Dentistry Society representatives. We received 476 responses from the pediatric dentists across the globe from 55 countries, out of which 98.7% of the pediatric dentists had either heard or understood about the whole technique, as you can see in this pie chart. When asked about their perception about the whole technique, most of the pediatric dentists agreed that initially there were some who totally opposed when they had initially heard about the whole technique, while this had clearly shifted with most of them being totally supportive of the whole technique over the time. Also, when asked if there was any clear radiographic difference between the whole technique and the conventionally placed preformed metal crowns, 67% of the pediatric dentists agreed that there was no any clear radiographic difference, thereby supporting the results that we received, where only 5 bitewings were identified correctly by the majority of them, with the average correct score being 4.9 out of 10. Thereby, this concludes a study that the majority of the pediatric dentists surveyed thought that there was no any clear radiographic difference between the whole technique and the conventionally prepared preformed metal crowns. Also, thereby supporting that they failed to identify them in half of the bitewing radiographs provided. Thank you.